to this episode of the NLN podcast, Nursing Edge Unscripted, the surface track, and thank you for joining us. This episode is entitled Celebrating Partnership, Transforming Innovation One Year at a Time. Our conversation today will focus on celebrating partnership that forges the path toward innovation, such as the introduction of simulation into nursing education. We will also discuss how longstanding partnerships evolve over time to transform innovation into new territory, such as competency-based education. Lastly, we will take a look into the future of healthcare and nursing education to discuss what's next on the horizon to help save 1 million lives. And to help us today, we have two special guests. Both guests work for Laerdal Medical, a longstanding strategic partner with the National League for Nursing. Akarsu is the Vice President for Healthcare Education, Lifesaver Solutions at Laerdal Medical. Rosie Patterson is the Vice President, Sales North America. Well, welcome, Rosie and Cansu. Thank you so much for joining me on this conversation. I'm really looking forward to talking about the importance of partnership and really the innovation work that can come out of a really good partnership, especially one that's been lasting for 20 years between the NLN and Laerdal. So thank you for joining me. The first question I wanted to start with was, I was really inspired by a keynote speaker at IMSH, and I think maybe both of you were there. His name was Ryan Leak, and he shared this breadcrumb slide. That's what he called it. And it pretty much had really important people and events that led him to where he was standing on stage that day, including like the person who opened the door for him and his kindergarten teacher. So I thought it might be fun for us to start our conversation today, asking you what your breadcrumbs have been to lead you to where you are today in your roles at Laerdal Medical. So I'm going to start with you, Cansu. Do you want to share your breadcrumbs with us?
No, yeah, I love the question. What comes to my mind is a big breadcrumb, if that makes sense. So I wanna refer to my big breadcrumb that has impacted so many parts of my life, both professionally and personally. So my background is industrial design, and in my 20s, I participated in a design challenge that was organized by Index Project in collaboration with UNICEF. It was in Denmark, and I was a student at the time. And when I joined this network, it was such a powerful group of individuals, companies, and that's kind of how it unfolded that I built my career on design for social impact. And Laerdal was also one of the companies that they had recognized. So both internships, other projects, and then Laerdal, it just kind of made its way. And I joined Laerdal actually from our sister company, the not-for-profit company, Laerdal Global Health, which is focused on maternal and newborn health primarily. But the fun fact is I even met my husband through this organization as kind of a friend of a friend and meeting there at an after party kind of thing. So I think
that's an important breadcrumb.
It is an important breadcrumb. This is a major breadcrumb.
Mm-hmm.
So when I met Rosie, I had transitioned from Laerdal Global Health to Laerdal Medical, and I was implementing design thinking in the company. I was also working with our leadership teams on our 2030 goal, which is helping save 1 million more lives every year by 2030. So there were numerous strategy sessions that we facilitated. And as part of that, I met Rosie, and I met so many other women leaders that inspired me to move into leadership. So I decided to take an executive MBA specialized in digital business models. And after that, I took on the role of leading our healthcare education team. And that brings Rosie and me again together because she has vast experience in this field. And that also invited me to our partnership with the National League for Nursing.
So can you share a little bit more about the work you did with that global arm of Laerdal Medical and some of the innovation that you created to, I think, have really important social impact in healthcare?
Absolutely. So I joined as an industrial designer, and because Laerdal Global Health is also a place where we work a lot with our partners, I truly understood the value of that. Both partnerships with, the end users who are midwives or midwifery educators, or those professional associations who are implementing the solutions we do, but also the organizations who we co-develop with. So I actually have contributed with a few different projects, and one of them is the Mama Birthy Birthing Simulator, which is a very low cost, very hands-on birthing simulator, both wearable and you can put it on the table, etc. And it's training on normal birth. So I think through this, I also could see the value of prevention rather than intervention. So this has been, a major project of mine in Laerdal Global Health. And the other one was the Nifty Feeding Cup, where we collaborated with PATH, Seattle Children's Hospital. And there I was championing this, really making this partnership happen with those organizations. Yeah.
That is wonderful, Cansu. Thank you for sharing. And I was wondering if I could hear, Rosie, some of your breadcrumbs.
Absolutely, be glad to. Well, I started my career at a company called Medical Plastics, and Medical Plastics was a company in Texas that was very well known in anatomical modeling and some patient simulation, but predominantly had a stake with nursing education and the military. And so we really worked very closely with thought leaders in the industry. And I come from a family of nurses, so I came well equipped to really embrace working with nurse educators, and have always been in sales and marketing, but also had an opportunity to work with product development. And that role is where I met Deborah Spunt. And I asked her to share with me what she did and why she was so passionate about it. And I will tell you, she shared with me and spent a lot of time with me and educated me to be the person that I am today when it comes to the importance of simulation in nursing education. And I think she also inspired me to take this up a notch. So fast forward to the year 1999, Laerdal and Medical Plastics had a joint venture. And we manufactured a product together called Recession Modular System. And to decide, was the company we're dating, would they eventually marry us? And they did in the year 2000. Now, in that time, we were also building a simulator, and to converge both the Laerdal technology with the Medical Plastics mannequins, we launched our first simulator called SimMan. And this was in the early 2000s. Now, knowing what I knew about nursing education, I thought medicine is all about simulation, but the nursing market is really important. And we need to find a partner that can help us understand the research, if there is any, and if there isn't any, how might we partner with said organization? And the NLN, I always went to the conference, but I really didn't know how to approach them. But I did know that a competitor of ours had a 3-year agreement with them to do research in simulation. And I also heard that it wasn't going so well. So I made a trip to New York City to meet with Ruth Karokaran, who was the CEO at the time, and Terry Valiga. And I'll tell you, they were tough cookies. They were like, so what is it that you have that's so different? And they challenged us. And so from there, the company just grew, flourished, but the partnership was really just getting to know people and build some trust among the two organizations and really find some common synergies that we could work together on. So the partnership has been evolving over the years, but this was really around getting started. And could simulation make a difference in nursing education? And having Pam Jeffries and Marianne Rislow as the orchestrators of this multi-site study that went on for 3 years, and we supported from the background and learned along with them. It was an amazing transformation in nursing education, and to see the pedagogy change and the simulation design scale, the framework that Pam developed get implemented across the world has been phenomenal. And just to tap into that, how I got to meet Cansu was I served, 3 years as the managing director in the UK and Ireland. And then I came back to the States and did a business development role. But then I was asked to go and manage our Asia Pacific region for 3 years, based in Hong Kong, but traveled all across. And in one meeting, I made a trip to Norway and I met Cansu there. And she was such a lively individual, and she was really facilitating some dialogues and workshops. And, I just clicked with her and I thought, this lady has a lot to offer. I've got to get to know her a little bit better. So we talked over the years, and then this project has really kind of brought us together closer. Her work in nursing education, her role as it evolved from the global health side to her nursing role now, has really put us together. And I think, yes, I've been around a few years. And so Cansu, being young in the organization in this field, she has said, Rosie, can you help me? And we just connect. We connect regularly to talk about issues in different parts of the world. But the beautiful thing is, we can take what we've learned in North America and we can leapfrog in other countries. And those countries want to know how we're doing simulation here. And we did, with the NLN's help, launch a program in China in 2017 that was quite successful. So hopefully that helps you connect the dots and the breadcrumbs with us.
That is amazing, Rosie. And what I'm hearing is, first of all, I think it's so incredible that you were there at this moment where that question was being first asked, can simulation support nursing education? And to be there at that pinnacle moment, and I don't mean to be super dramatic about it, but it is so important to me, because simulation has been such a central part of my development and specialty in teaching. And I remember the moment I saw simulation for the first time, I was like, this is it. It just clicked. It just made sense to me. So for you to be there at that, those first moments where those stakeholders and those partners and those collaborations were coming together, and Pam Jeffries and Marianne Rizzolo and many others were helping to take what medicine had started. And I would even say military, right? You mentioned the military and our other interdisciplinary partners where we get inspiration from, where that was kind of being, these first few leaders in nursing education were taking that and pulling it into our current curricula, our current teaching strategies. I just think that's amazing. And then this intersection with Cansu, where I think, Cansu, I see you as having this energy and this passion and fire of making change and innovation happen in, right now, but more importantly, I think in the future. And you're at this part where you and Rosie have come together with Rosie's, I think, foundation in simulation, and then the two of you pushing forward into how can we really propel nursing education and make it, I think, better. And we're going to get into that. I'll as a little kind of precursor, right? We're going to talk about some competency-based education. We're going to get to that, but I think that is where we're hoping to go. And I think, Cansu, you're just the person to help lead nursing education in that way and really support nursing education to move in that direction, because it's challenging. So thank you both for sharing that. I will also share that where I also intersect with both of you is with a few breadcrumbs that I've had is I started my teaching in the academic setting in 2010. I started in a small community college, and I was there for maybe 5 minutes, and the director came to me and said, we've got this mannequin, it's in a box, and I think, I also heard that Pam Jeffries at Johns Hopkins is running this statewide consortium thing, and I have to send somebody, and it looks like I bet you like technology, don't you? And I was like, sure, I guess. I mean, I know how email works. So she said, well, I just need someone to learn how to run these mannequins and get them out of the box. So will you go? So I went and met Pam Jeffries, and that's where I got my start in simulation education, right from how fortunate was that, right? Right from the person. Through Pam Jeffries and that experience, I was able to make a transition into teaching with simulation full-time at University of Maryland School of Nursing in the Deborah Spunt Simulation Lab. And I was mentored there by Mary Fay, and Mary Fay connected me to Sue Fernaris, right? And then I got therefore pulled into the NLN very excitedly and willingly. So I just, I also want to share with you, Rosie, one very important thing. While I had the sincere appreciation to work and the privilege to work at the Deborah Spunt simulation lab, I never got to meet her.
Can I share something with you?
Yes, I would love that. Yes.
I happen to have something I'm really fond of, and I hope you can see this, Michelle and Cansu. This is a picture of the core members who started the NLN study with us. And here you will see, let's see if I can do this from behind. You see Deborah Spunt here in the pink, and Marianne Rizzolo and Pam Jeffries down the front. These were the core members of that original program. And, there's a lot to be said about Deborah Spunt. And you're describing her, even though you didn't meet her. She was so fascinating, but never wanted to be in the limelight. So always in the background, never wanted anyone to recognize her. But when she was in this program, she came to life. She was so passionate to teach the others because they were younger in simulation. She was sort of the pioneer and led the way. So it's exciting that you got to walk in those footsteps.
Well, it's really truly has been a privilege, and my very early days of mentorship I always say that I've had really important mentors by just sheer, luck, and I don't know, the universe has put them together with me, and I've had very important mentorship moments with each of those mentors that I continue to benefit from and to grow from and be able to share with others. So, and that all really started in that Deborah Spunt simulation lab. That's really where a lot of that came together for me. So thank you for sharing that. And I always feel kind of sad when I think about not having met her, but I think having been introduced to so many of the people that have been inspired by her, I feel like by osmosis, there's some connection there. So thank you. And I'm looking forward to at the summit where we always celebrate her contribution to simulation. So I'm looking forward to that as well. The other thing I'd like to kind of transition us to is, speaking of celebration, is that, I really believe that success is rarely achieved in isolation. And there's been a very important partnership that you highlighted, Rosie, between the NLN and Laerdal Medical. And this partnership, we are celebrating 20 years of its work together. So I wanted to hear a little bit, if you could talk about this partnership, how it's evolved and where we are today. Maybe, and we can revisit our breadcrumbs. We talked about your professional breadcrumbs, but maybe we can talk about the breadcrumbs of the NLN and Laerdal.
Absolutely. So this started out as an idea to do some collaborative research to see would simulation make a difference in nursing education, and could it even help with the clinical access shortage. So we knew that there were several angles, but really to understand, could there be a standardized method in which we could measure and evaluate and debrief simulations? And I would say that first 3 years set the foundation. And the icing on our cake was the book that was published. That was not in the scope of work, by the way. The book that was published came after the fact. And Laerdal, he's a very creative and generous person. He looked at some of the artwork and said, I think Laerdal can maybe help with some of this, and we can make it look much nicer. And so, of course, the graphic artist got involved and helped with, making sure that this book was very well articulated and had the right artwork in it. And he became very interested in dissemination. And so from there, he said, okay, how will we disseminate this? And what is the next step that's needed? And Pam Jeffries said, faculty development is a big gap. And it's one thing to now have the research. It's another thing to educate the faculty in how to use simulation and how to integrate it into the curriculum. And so we set about developing this online learning program called SIRC, Simulation Innovation Resource Center, where we had these faculty development online modules. And that was in order to help, but the NLN really pushed forward with this to say, look, we've got these, we'll give you CEs if you take these courses, and they will help your faculty. And so we had Meet the Expert immersed in the modules. And so this became a way to help to really proliferate simulation education in nursing. And so that was in 2006. So the research 2003, 2006 SIRC, 2009, we did more things. And this evolved over many things, but they all built off of that same simulation design framework. And it was scaffolding over time. And to say that this was not just in North America, this was known in other countries. And we got the NLN, we had representation, you know, as I said, in many countries with Pam Jeffries, Mary Ann, Sue Fernandez, Bev Malone. And this is just grown over time. I think with the future ahead of us, there's so much more we could do. We are just getting started in this partnership. This is just the early days.
That's amazing. And I definitely want to, you know, get to this conversation about where we're going in the future, especially with CBE or competency-based education. Right before we get to that part though, you know, Cansu, I was wondering if you can share a little bit about sort of the daily work of innovation, right? It's one thing to be partners with two organizations, right, that are very busy and have a big reach. That's a very, like, on a macro level, but on this micro day-to-day level, how does innovation get done? And I think you being the design expert, yeah, I'd like to hear how, from your perspective, how you see that.
You know, there is no recipe for innovation, but there are definitely good principles and work cultures and partnerships that can help innovation. So maybe it could also help a little bit about how, you know, the different professions get involved in innovation. So the healthcare education team that I'm heading up, we craft the vision and strategy and the rolling action plans towards competency-based education. And in close collaboration with the NLN, but also the NLN member institutions, we really work from early days of exploration, discovery, need finding, all the way through concept development and you know, delivery of solutions, but also the implementation as well. And it's from that really open questions that we've been asking to those institutions and the educators where I appreciated the primary challenges that are faced, the shortage of the faculty and the lack of clinical sites. And despite those challenges, the pressure to educate more students at a higher quality. And when you look at how that translates to what we then offer as solutions, it's really tools that help with educational strategies like peer-assisted learning or self-directed learning, where the goal is to offload the faculty as much as possible, but also, for instance, tools that will enable them to collect and track data on the student performance over time, so they can actually take in and educate more students. And when it comes to, you know, clinical placement as well, there are alternative ways that we could provide clinical preparedness, such as the simulation solutions, of course, but also using virtual reality that we can talk about later as well. And on an everyday basis, I mean, it's a mix of business development, product management, design, educational specialists, marketing, and again, also similar roles at Laerdal and the NLN working together. And I think it's also, I would love to hear from you as well, Michelle, because you collaborate closely with our educational specialists and in the co-development of the patient cases and how the assessments are provided in various solutions. I think you're even at the heart of, you know, making these things happen.
You know, it's funny, Cansu, I've had several conversations with another colleague of mine, two colleagues, Dr. Rachel Onello, who's usually my co-host, my partner in crime here, and Dr. Matthew Byrne. And the three of us have had some deep, really interesting, nerdy conversations around how people, it's really called in some of the literature, it's called third space, where people from different professions and this kind of interdisciplinary platform come together with this purpose of either innovating or solving a problem, and get very intentional about getting into this space where this sort of like magic can happen. And that magic of innovation, like you said, there's no recipe for it. And I think that's because when these people and these different minds, like you said, like marketing and design and development and education and medical, right? All these folks and these expertise.
And technology as well, and technology and development and data scientists. So just want to also add that.
All of it, right? All these people come together to create this super magical thing. I think what it takes to do that is a little bit of, everyone has to be able to, on some level, blur the boundaries of their roles, right? Of their expertise. And blurring those boundaries allows for the creativity and the agility. I think that has to happen when you're trying to either innovate for something new, create something that doesn't exist, or really solve a problem. You just have to, when people say think out of the box, I think that blurring between I'm a nurse and I have to provide my nursing expertise. Well, I'm a nurse, but I'm also a human. And I also have many different pieces of my experience, like my life experience, that I can bring into the conversation, but also receive. More importantly, receive. It's more about receiving the dialogue and the creativity. I think that happens when you bring all these minds together. And I think when we can really appreciate and get excited by these different people that come together and these different ideas, I think that's when innovation has happened in my experience. So when I went to Copenhagen, right, to work in person with colleagues, with the design team at Laerdal Medical, it was, and development and education, everybody was there, right? It was just amazing. Like, it was 3 days of just third spacing, like getting it done. And it was amazing. So
it's also the fact that, you know, our professional backgrounds is just one aspect of diversity that we bring in. I think we are so many people from many different countries. I was born in Turkey. I'm Turkish, Norwegian, you know, and we have so many team members. And, you know, Rosie, you've been in multiple countries leading various organizations of Laerdal. So it's to acknowledge and appreciate and put teams together intentionally and foster diversity in them to enable that third space and more spaces also.
we want to be conscious of our time boundaries. This conversation could go on, and it will. We will pick up with our conversation with Cansu and Rosie discussing innovations in nursing and competency-based education on our next episode.
Thank you for joining us on this episode of NLN Nursing Edge Unscripted Surface. We hope you join us next time. Until then, remember, whether your water is calm or choppy, stay connected, get vulnerable, and dare to go beneath the surface.